abnormal hemoglobin formation that leads to the sickling of the red blood cells, right? Right? So instead of having a regular red blood, having regular red blood cells with nice, squishy, rounded, donut-shaped cells, rather we will have amongst them what cells that are sickled in shape. You see any sickled cells? A lot, right? So the red blood cells now are not rounded anymore, but rather they have what? They are sickled in shape. They look like the blade of a sickle. Stop me if you have any questions. Then the next one is Burr cells. Burr cells are formed from, I have not been reading, sorry. So the sickle cell, this is inherited condition results in production of abnormal hemoglobin, which periodically causes a severe distortion of the red blood cells. So-called sickle erythrocytes are shaped like the blade on a sickle. That is like a crescent moon. Unfortunately, the available slides do not show an abundance of sickle cells. You may need assistance from your instructor. Another reason for the different difficulties that they cause some of their symptoms by sticking together. So rarely will you see one by itself, either partially or completely obscured. The next one is the Burr cells. This condition typically caused by kidney disease, which results in uremia, which causes an elevation of blood toxic waste such as uric acid and creatinine, also produce the characteristics of distortion of erythrocytes. This results in many red blood cells appearing to have protruding spikes like a burr or gear. All right. Variable features. Occasionally, red blood cell slides, other than this one, will appear spiky looking, possibly due to a quirk of perforation. But this is the most distinguishing feature of uremia. So basically, you're looking for what? Red blood cells that have spikes. Do you see the spikes? If you look at the border of the red blood cells, you see the spikes that are coming off of it? All these spikes. So when you're looking at the red blood cell with these protrusions coming out of them, that is what? That's the Burr cell or uremia disease. All right. Then the next one, aplastic anemia, omit that. We're going to parasitic infections. The parasitic infections, we'll be just looking at two things. The parasitic infections is also be looking at the red blood cells. There are two types. We will look at the Plasmodium vivax and also the Trypanosoma gambiense. Basically, these parasites are protozoans, and they will either affect the red blood cells by getting inside of it, or they'll just be in the blood. Okay. So the first one, the Trypanosoma gambiense or gambiense. I'm sorry.
I think we skipped one. Did we do the plastic?
We're omitting that one.
What did I say about aplastic anemia?
I didn't.
Jumper, wake up.
No.
I said omit. We are omitting that.
Ah, okay.
All right. So the Trypanosoma, this is a species of flagellated protozoan, a parasite which invades the blood from the bite of an infected cystic fly. The disease is called African sleeping sickness. These parasites will be extracellular, that is within the blood plasma. They will appear worm-like with a tail. They are about as long as 2 to 3 red blood cells. There is no variable feature since these organisms are so large and distinctive. So like if you're bitten by this fly, basically as I'm talking to you, I'll be talking to you and then I fall asleep. All right. That's how interesting the disease is. All right. But these ones are very easily distinguishable. We'll basically be looking at worms in the plasma. Do I need to point them out to you, the worms? You see them, right? The Plasmodium, all the blue worm-like structures you see. Those are that's Plasmodium, trypanosoma, gambia. All right, so that's easy to distinguish, to identify, right? And then the last one is the Plasmodium vivax. This is the protozoan that causes malaria. This is a completely different variety of protozoan. The disease it produces is called malaria, which is contracted from the bite of an infected mosquito or receiving blood from a transfusion or sharing hypodermic needles. It is intracellular, invading the erythrocytes. Look for red blood cells with any of several possible abnormalities. A dark center, which will make it seem nucleated. This should not cause confusion with lymphocytic leukemia. Just look back and forth between the two microscopes with each one cell. Now, you keep in mind that the leukemia is white blood cell. This is a red blood cell. So you're looking for a red blood cell with a red blood cell that has a nucleus. We know that normally they don't. So if you see a red blood cell with a nucleus, that tells you that it's been infected. That's one way of identifying them. Or there will be a dark wreath-like ring, whether it's partial or complete inside of it. Or there will be small dark spots in the cytoplasm. Within the red blood cells, these organisms go through a complicated life cycle with several changes of appearance as they develop and reproduce. Eventually, they will be released from the red blood cells. Different individual organisms will not be at the same stage of their life cycle. Explain the varied experiences as described above, which will be seen in any one blood smear. So, let's find our Plasmodium. Things that you can clearly see that they are red blood cells, but then have stuff in there. Some are more obvious than others. So. Do you see that this is a red blood cell? Do you see this is a red blood cell? But then it has a dark spot inside of it. Okay. There's another red blood cell. It has a dark spot like a nucleus inside of it. Okay, this is the one I was looking for. See, these are red blood cells, and then they have dark spots inside of it. I thought this is another one, but if you see this, this will confuse you. You may think this is a lymphocyte. Okay, and that one too. But the clear ones are the ones that you clearly see that it's a red blood cell and they have a dark spot inside of it. Some may look like wreaths, some may look like just red blood cells that are spotted, and some may actually look like a nucleus. One of the things you also have to keep in mind, remember that when we're looking at a regular blood smear, whole blood smear, you notice that a lot of, in the ending view, the entire screen would have been filled with red blood cells. But we don't see it this way. These are all, unfortunately not this one, but the anemias, we did see that when we saw that we had lost a lot of red blood cells. Even with this, the plasmodium, when it affects the red blood cells, it destroys them. So it can lead to anemias as well. So you see that we don't have a full screen of red blood cells as we're used to. So here we go. A lot of red blood cells with infected red blood cells there as well. So you can either get this view or you can get one that is more like a nucleus inside of the red blood cell. Alright. Okay, 80 questions. That's all that is left to do with red blood cell pathology. So then the next thing we're going to do part of chapter 7. We're going